Looking back on the last 12 months of COVID-19, in Victoria we've had to endure a tyranny. Why do I say this? Well, let's start at the beginning. Why was the original Victorian COVID-19 pandemic plan abandoned by the Victorian government? Victoria's original plan was published by DHHS on the 10th of March 2020. The Victorian government threw it out and instead opted for lockdowns and heavy-handed police enforcement, which amounted to a reign of terror. So why did this happen? First, what was the original COVID-19 pandemic plan? In a previous video, I explained the original plan was a level-headed approach that focused on protecting our most vulnerable, the elderly in our aged care homes. It didn't speak of lockdowns of Melbourne or Victoria or shutting the state borders. This original plan anticipated and planned for a much more serious outbreak of the virus. It could scale up its response so that additional steps could be taken should the virus spread more than we first expected. But overall, it was a calm and level-headed approach to the threat that COVID-19 presented. And it also complied with our obligations under international law that Australia had signed on to. So why did we get this reign of terror? First, we don't have all the facts. So we have to figure out why the Victorian government abandoned its original plan. What we can do is put all that we can find in the media into chronological order, and then look at the chain of events and try to look for reasons. It's not ideal, but until Daniel Andrews decides to share more information with us, this is probably the best we can do. So what happened and when? On the 10th of March 2020, DHHS released their original COVID-19 pandemic plan. On the 15th of March 2020, 5 days later, the Victorian Chief Health Officer, Brett Sutton, wrote a memo to the Health Minister advising her to declare a state of emergency. On the 16th of March, based on his letter, the Health Minister signed a state of emergency effective from the 19th of March 2020. On the 23rd of March, lockdowns came into effect, and by this time it became clear that the original COVID-19 plan had been abandoned. Now, what else happened during this time? Well, on the 16th of March, or possibly even as early as the 10th of March, close to when Brett Sutton wrote his memo to the Health Minister, a research paper was published by Neil Ferguson of the Imperial College London. It contained extremely worrying predictions about the spread and the impact of COVID-19 based on a computer model he had developed. He predicted as many as 40 million people would die worldwide if coronavirus was left unchecked. He predicted Sweden would experience over 95,000 deaths from COVID-19 without lockdowns. The bulk of these deaths would occur in April 2020. He predicted Sweden's intensive care units in hospitals would be overwhelmed before May 2020. His computer model also predicted the hospital system in Australia would not cope, and up to 150,000 Australians would die from COVID-19. Most likely Brett Sutton would have been aware of these predictions, possibly even before they were formally published. So what was he going to do? The original COVID-19 pandemic plan did not call for lockdowns. But here we have a frightening prediction from Neil Ferguson saying that without lockdowns, tens of thousands of Australians would die. It's quite possible these UK predictions alarmed Brett Sutton and others. When we look at Brett Sutton's memo to the Health Minister on the 15th of March, we see he repeatedly refers to these computer models and even uses the same language as the UK researchers. Possibly he and Daniel Andrews looked at their pandemic plan and saw it didn't mention lockdowns, so they simply threw it out. I could be wrong, but from what we can piece together, that is most likely what happened. Now, Brett Sutton's memo to the Health Minister. Some people said that Brett Sutton's memo was hysterical, unbalanced, and even worse. I wasn't sure why, but if you download it and read it carefully, some things become clear. It mentions the federal government and the WHO, who both think the virus is deadly. Then Brett Sutton says that he has taken an evidence-based approach to the pandemic, and that, by the way, is what he's required to do according to Victorian legislation. Also, he says his recommendations are proportionate to the public health risk. That also is what he's required to do according to our international commitments. But there's little evidence that Brett Sutton did either of these things. He used the UK study a lot in his memo. He refers to their computer models as evidence, which of course they are not. At best, a computer model is just a mathematical simplification of real-world processes. Computer models simplify and make assumptions about many different things, which are not always checked and tested by others. At best, these computer models are theories or even guesses based on debatable assumptions. By April 2020, around 1 month later, these computer models were seen to be wildly inaccurate and seriously flawed. But in mid-March 2020, we see that Brett Sutton had most likely read the alarming UK research paper. In his March 15 memo, he uses the computer model predictions. He says in paragraph 29, "At the peak of the infection, there will be 120,000 infections in Victoria daily. There will be 13,000 people seeking health care daily. There will be 540 requiring hospitalisation daily, and 145 requiring ICU admission daily." He even refers to the modelling in paragraph 31 and says the modelling suggests that 3,192 people will die in Victoria from COVID-19. But there were serious problems with these computer models, and we will see shortly that these British researchers have a long history of getting things wrong. But for now, you would think that Brett Sutton, an experienced and trained medical leader and manager, would have been aware of the past failures of these researchers and their computer models, and taken their predictions about COVID-19 with a large grain of salt. But that does not appear to be the case. Why was Brett Sutton's memo to the Health Minister even called hysterical? One person even called it demented. By April 2020, it became clear that COVID-19 was nowhere near as infectious or dangerous as the computer models were saying. Brett Sutton would have known this, but he didn't change his position. It appears his decisions were more influenced by fear or politics rather than science. From this point on, the Victorian government started to play recklessly with evidence, people's lives and people's livelihoods. So what's wrong with a computer model? I've mentioned some of the problems with computer models. Let me list some more here. A computer model is nothing but a computer program that tries to predict something that's going to take place in the real world. All computer models need to simplify the real world down to a set of mathematical equations. Because they need to simplify the problems, many assumptions are made. This is because it's not possible to incorporate all the possibilities found in the real world into a computer program. So assumptions will often be made about many things. For example, with a virus. How will it be affected by temperature and climate? How many other people will one infected person spread the disease to? How will people's changes in behaviour affect or hinder the spread of the virus? Assumptions will be made about factors like these, and mostly they're not checked. In fact, if you consider the human element, the results produced by a computer model can easily be influenced by the fears, beliefs, assumptions, prejudices and pessimism of those who created it. The predictions from the UK were alarming, but by mid-April 2020 it became clear that this disease was nowhere near as lethal as had been predicted by these models. And by mid-April 2020, all epidemiological computer models had completely failed and were shown to be wildly off the mark. These UK researchers have a long history of getting their predictions completely wrong. Let's start with the COVID-19 computer models. Please read the Telegraph article dated the 28th of March 2020, which I've linked to in the description. It's simply alarming. Neil Ferguson works for Global Infectious Disease Analysis at Imperial College London. He predicted that 510,000 people would die in England if the UK government took no action with COVID-19. Or 250,000 people would die in England if the government did not change its conservative approach to COVID-19. And 40 million people would die from COVID-19 worldwide. The Telegraph found that these alarming numbers led directly to the countrywide lockdown of the UK. But it wasn't long before Neil Ferguson was severely criticised by other researchers. The Telegraph article is dated the 28th of March 2020. So 22 days or so after he released his results, other researchers were saying his computer models were flawed and he did not account for the effects of control measures that would hinder the spread of the virus. They say his models were not fit for purpose. Notice that, not fit for purpose. That is a polite academic way of saying his work is basically useless and possibly nonsense. That's pretty bad. Others said it was difficult to understand what informs the models, in particular the transmission rate. Again, that's a polite academic way of saying we don't know where he gets his information from and we don't know if it's correct. That's also a pretty damning thing to say. And this isn't the first time that these UK researchers have done this. A while back, Neil Ferguson's computer models predicted an epidemic of foot and mouth disease among farm animals in the UK. He recommended that not only should infected animals be killed, but also all animals on nearby farms be killed regardless of whether they were infected or not. Now, the UK government adopted his recommendations, which led to the killing of some 6 million cattle, sheep and pigs, the vast majority of which were perfectly healthy animals, which did not need to be slaughtered. It was the wholesale destruction of animals, and it cost the UK about £10 billion. He was severely criticised, but the UK government chose to listen to him and not his critics. Also, in 2001, his computer models predicted that 150,000 people would die in the UK because of mad cow disease. 20 years later, only some 200 people have died from mad cow disease in the UK. As before, others said his computer model was not fit for purpose and was at best crude and at worst inaccurate representations of the epidemiology of the disease. Neil Ferguson has been a terror when it comes to his predictions from his alarmist computer models. You have to wonder about this man. And he's done the exact same thing again with COVID-19. Johan Gesecki, the former chief scientist for the European Centre for Disease Control and Prevention, has opposed Ferguson's calamitous estimates. On the 28th of March 2020, he said that Ferguson's model is one of the most wrong papers ever published. Later, Anders Tegnell of Sweden got his model investigated by his team and has repeatedly stated in the media that he does not agree with Ferguson's finding. On May 10th, Dagens Nyheter, Sweden's biggest daily newspaper, analysed a pair of models inspired by the Imperial College of London study, which predicted as many as 40 million people could die if the coronavirus was left unchecked. These models predicted that Sweden's ICUs, that is their intensive care units, would be overwhelmed before May 2020, and 96,000 people in Sweden would die from COVID-19 by July 2020. Total COVID-19 deaths in Sweden stands at 5,700 at September 2020, nearly 90,000 less than the model has predicted. Hospitals were never overrun as the models predicted. Daily deaths in Sweden have slowed to a crawl. The health agency reports no new ICU admissions. Recently, the scientist Mike Yaden has said that no serious scientist gives any validity to Ferguson's model. It's important you know that most scientists don't accept that Ferguson's model was even faintly right. One paper also said that he has no credibility in the scientific profession. This is all pretty damning. Now remember, the deaths predicted by the UK researchers were to occur prior to May-June 2020. These predictions were simply not accurate in any way. Unfortunately, the progress of COVID-19 has not yet halted. India is facing a death toll of some 350,000 as at the time of writing. Other nations are coming to India's aid with equipment and supplies to produce vaccine. So far, we've seen the predictions of the computer models are wildly inaccurate. Let's hope also that the predictions of 40 million deaths worldwide does not come true, and India is able to bring the spread of the virus in their country under control. This video continues on part 2.